My name is Brittany. I am a physical therapist assistant at Innovative PT Solutions here in Watertown, New York. I'm also a certified personal trainer through the National Academy of Sports Medicine. So today I want to show you some stretches to do for a total hip replacement. There are precautions if you have the posterior-lateral approach. That will mean if your incision is more towards the back and the outside of your hip versus the anterior approach, which is in the very front. Usually the front, they might have a couple precautions for you. It's not as drastic as a posterior lateral. So I'm going to go over those first. If you had a total hip replacement within the first, I think 4 to 6 weeks, usually around 6 weeks, there's going to be certain movements that you cannot do. One of them being flexing past 90 degrees. So if you are laying flat, this would be 90 degrees. You're looking at the torso to the thigh at 90 degrees there. You also cannot cross your legs. So you cannot go past that midline there, and you cannot internally rotate. So I'm going to show you one of the motions or actions that you might not even think about as you're rehabbing and going through this first few weeks. You might do and not even think about it, but I really want you to pay attention. Number one place for you to end up doing that motion is in the bathroom, on the toilet. That being said, you want to raise the toilet seat up so you're not at that 90 degree here. So you can see my angle is good. If you have your toilet paper roll behind you, that leg is going to internally rotate, causing you to do a motion that you are on precautions for. So you want to make sure you place that somewhere. Make sure that it's not too much, because look at that. We're breaking the 90 degree again. Have it there right next to you so you can grab the toilet paper without having to break those precautions. So this is what you do not want to do. This is what you want to do. All right? So no crossing the leg, no bringing it past midline. That also means when you're sleeping, best thing to do, grab a pillow, put it between your knees. And if you have to sleep on your side, put it between your knees so you're not breaking that as well. Okay? All right. So one of the exercises that you'll want to do is a quad set. So having that leg down, press that knee down, tighten up this quad muscle, and then relax. So I'm going to have you do that 10 times, holding for 5 seconds each. You can look at the muscle and watch it contract. You can also feel the muscle and watch it contract. And you can do this sitting up like this, or completely laying down on your bed, on the floor. Usually the bed is going to be way more comfortable though. And just performing that quad set 10 times, 5 seconds each. All right, good. And then we're going to go into some heel slides. You can use a dog leash if you would like. You can also do this with just pulling your heel up by itself. So coming up here, watch that you're not breaking that 90 degree. You're good. Back down. And again, you're using your hands to help you get a nice good stretch stretch, kind of moving around that hip a little bit, but also very gentle. All right, very good. Good thing that I don't have a hip replacement because I would have broken my 90-degree already. All right. Next, what you're gonna do, and you can have help with people putting on the dog leash if you need it, so you can ask for assistance, that's okay. Next one, you're gonna be laying on your back, bend those knees up, and then you're gonna come up into a bridge, squeezing those butt muscles and then coming back down. Hold for 5 seconds, 10 times. Now, if you can't get all the way to this position, that's okay. Squeeze those glutes as much as you can. Try to pick your butt off of the table or the bed and go as far as you can. If you're noticing that is too difficult, you can straighten out your legs and do a glute set, and that will help fire the muscles and build up that strength so you're able to go into the bridge as a progression. So if you're finding that the bridge is a little bit too difficult at this point, just squeeze your butt muscles, hold it there for 5 seconds, and relax. That will start firing those glute maximus muscles. And if you want, you can do both exercises. That's okay. All right, good. Now, the first week or two, this next exercise might be really difficult, and that's okay, but you will end up having to do a straight leg raise. You're gonna have your legs straight, press that knee down so you're firing that quad already, just like the quad sets that we just did. So you're firing the quad, keeping the legs straight, raising it up just about parallel to the other leg, and then back down. This is your straight leg raise. And like I said, it might be really difficult at first. As you progress, it will get easier. And sometimes you might need someone to help you bring the leg up and see if you can hold it at the top by yourself. And then have someone help you lower it back down. And then the next step would be have someone bring it up. You hold it by yourself and see if you can control it on the way back down. And then eventually you'll be able to raise it up by yourself, hold it up there for 5 seconds by yourself, and then lower it back down all by yourself. So this is the straight leg raise, and you only want to go parallel to the other leg, and you want to keep the other knee bent. That's going to take pressure off of your lower back, and it gives you a good goal to shoot for that other leg, and it's keeping tension on that hip flexor muscle. You'll feel that soreness in the quad and hip flexor on that straight leg side. All right. Next, I'm going to show you a couple exercises sitting down. And again, you might have additional exercises given to you by your therapist. That is awesome, that is good, but these are some good basic ones for you to start with. So again, in a sitting position, use a pillow underneath to avoid that 90-degree, and then you're just going to come up, contracting that quad and back down. So you can do a hamstring curl with this too, activating the back of your leg, where you're actually bending your knee and coming up, and then you're contracting your quad, straightening that lower leg. So hamstring, quad, back and forth, without getting a cramp. All right. just some basic exercises that you can start with after having a total hip replacement with a posterior lateral approach. If you had the anterior approach, please make sure you're not on any other precautions prior to starting any exercises. And again, review those hip precautions even with the posterior lateral approach, because you really don't want anything to happen to that new hip. Alright? After doing the exercises, you might be a little sore. Put some ice on your hip. Let yourself kind of relax and take that inflammation down a little bit. You're going to have swelling. It's going to be uncomfortable. Do not lay on that side. And, you know, just keep pushing forward. It will get better towards the end. It's okay. You know, just keep going, keep stretching, keep building that muscle, and then you'll be right back to doing what you want to do. Alright, bye guys, thanks for watching.